I went into her car, and then when she finally came to a stop, I ejected from the car. And I went approximately about 35 yards
Forward.
forward.
Let's go over what, first of all, caused the traumatic brain injury.
Hit the piece of metal stabbed me in my skull.
That's what we call a contusion. Okay. That contusion may then cause swelling, and then there's secondary injury, which can be as important, if not more damaging. Now, whether there's any long-term problems, only time will tell.
When you have someone who has a traumatic brain injury, you've had trauma to your brain.
We're taking you beyond the red line. I am Dr. Carrasco. I specialize in treating those who suffer from pain. This is the Dr. Carrasco Show.
Well, I mean, a lot of doctors do things differently. I mean, I wouldn't allow your wife and your baby in my operating room. It's not safe. It can be traumatic for the child. I don't need your wife to see it. There's no reason for that. We do care here differently. This is potentially can be a very painful procedure, even though it didn't appear to be. But I want to be safe. In fact, I have a policy that I do not allow the mother, and I sure would not allow your 3-year-old daughter to be in the operating room and want to do the injection. When you have someone who has a traumatic brain injury, okay, you've had trauma to your brain. That's what that means. Then now you have to look at it from multiple levels. Neuropsychological, in other words, what is the ability to make decisions, to discern between left and right, and 1 and 4, to add, subtract, and all the things that he did before.
I got up, I went to work this morning. Everything was going well. But I'm glad I'm here because my arm was hurting while I was working today.
Okay, so you worked this morning already?
Yes, sir.
It's going to be a little uncomfortable when you kind of inject underneath the skin so I can get as much of that scar to improve. All right. Then once we do that, we're going to inject some of this shoulder girdle, see if we can stop some of the pain in between the shoulder blades. I mean, there's risk of injecting into a blood vessel. We'll be careful with that. We aspirate the whole time. There's risk of injury to the nerves, paralysis, death. I got to tell you that with everything that we do, but that's just kind of really nothing to be concerned about with what we're going to do. I've done this many, many, many times. Okay. So we'll be real careful like we always do, and everything should go just fine.
Okay.
Okay. Any questions? You understand all the risks?
Yes, sir.
You kind of seem concerned with the risks. But it's a very safe procedure. We've done this thousands of times. We're going to be monitoring your heart and your lungs and everything as we do the whole thing. It's really a simple little thing. I just wanted to let you know that those are your risks.
I trust you.
Okay, we'll take good care of you. I'm going to give you something to relax you now. All right, very good. We'll give a little sedative there to get that going. Okay, you ready to go? We'll take good care of you, okay? Okay, we'll see. Es no es cosa grande. Just take just a few minutes. Okay. You know, we talked to Mr. Werner, and he seems like he's very intelligent, at least intelligent enough. He seems like, you know, for the hour that we saw him, he does pretty good. He can answer the questions. He sometimes stutters a little bit as he's trying to get some things out. But he seems like he's very, very normal.
Traumatic brain injury is the sudden injury to the brain. That is what trauma means, is that it is suddenly afflicted. Suddenly afflicted. Typically, it's going to be when your brain, which kind of floats inside your skull, comes to a sudden stop.
You know, an injury like that, the brain, what happens sometimes is jostled around. I mean, I used to be a professional ring physician, and we always knew that it was the acceleration, deceleration, the sudden rotation of the brain that made people get knocked out. It wasn't the blow per se, it's how fast that head turns. So let's talk about it as a whiplash, for example. When you get hit from behind, your neck's accelerated backwards, then it decelerates when it hits that certain point. And then what happens? Your body will go forward. So it'll accelerate again and then try to decelerate as it comes back toward normal. You had traumatic brain injury?
Yes, sir. Yes, sir. I don't remember my past. A lot of my past, like my grandmother's funeral, us getting married, my wife and I, those are things I don't remember.
But those happened before the injury.
Before the accident, there's a lot of my past I don't remember. Especially, I would say, the 3 months prior to my accident is blank. Absolutely blank. I do not remember it.
If you have a bucket of water and you drop a pebble on the edge of that bucket, you see the sound waves travel to the other side of the bucket, and then they bounce and they travel back. And if you think of where those waves are dispersing their energy caused by the pebble, it all gets concentrated closest to the center of that bucket. Okay? Now in this case, brain is mostly water, and your skull acts like a hard, bucket surrounding it. So whenever there's an injury, sound waves go back and forth inside the brain, but they have to release their energy somewhere. And the greatest area of concentration of those sound waves is the center of the brain. It just so happens that the hippocampus is the structure most responsible for processing memory, retaining memory, and retrieving memory, handing it back to you when you ask for it.
And
Does seeing a picture help you remember, or at least kind of
yes,
rationalize it,
yes.
or no?
Pictures help. They still feel foreign when I look at pictures of taking my daughter hiking, and I look at these pictures and okay, they look awesome. That looks awesome doing that for my. But the thought of actually trying to remember it, the event. We came across a rattlesnake and you took pictures of it. I don't remember coming across no rattlesnake, but there's pictures of it, so we must have. We came across some big turtles in the desert. We camped. I don't remember camping, but we have pictures of it.
It's not uncommon that at the time that you took a mild head injury, that you forget what happened recently. Typically, if you forget that short-term memory, you may recall it later because someone asked you about it. Or someone told you the story, and now you're making new memory to remember those events, but you may not actually ever recall it independently.
And the neurologist said to take some classes. My neurologist in Utah said to take some classes at an adult education center to help me with looking at a clock and knowing what time it was.
So, like, if you looked at that clock before that, what would happen? You would
the
read
three
numbers?
would be look right. The 3 would look like an 8 to me. I wouldn't be able to tell the difference of which was the long hand, which was the short hand. It would take me a while, and so I had to learn how to tell time again.
Numbers and letters are part of memory, a small part. If you forget numbers, that may be more of a loss of your symbol recognition that is not a letter but a number. Or it could be your retrieval of those numbers. Chances are they maintain that memory of numbers, they just can't retrieve it.
Think of it like a computer's hard drive. All the information is stored on that disk as tiny files. But if that disk becomes cracked or scratched, the information is still there, but you can no longer gain access to it.
There is things that we call soft-wired, where an alternate pathway can be found. Typically, the brain will actually start looking for detour pathways to get to whatever activity is being asked of it. In this case, recall numbers, recall letters. Sometimes the person figures out, how to get there on their own. And sometimes it takes someone to continue to evaluate them, put them in different challenges, and then figure out by which means they're able to get there.
I learned to read again, and I was a phenomenal reader. I used to read 3 books a week at my job, and then right after the accident, I couldn't read the newspaper.
I know know, you keep telling me you're having a lot of pain. Right. But I understand that you're upset about this. And I saw you last time, and you said that your scarring was improved and it was less sensitive, and your pain was better. I mean, to me, that shows to me that you're somewhat better. I said, you've got a lot of issues that I've talked about at the first visit that you need to get help with. And you don't want to get them done. And I can't help you unless you get that done.
What might happen with traumatic brain injury at times is impulsiveness. I mean, you and I may have a thought or an itch, and we'll say, well, this is not the proper time to scratch, I'll just scratch later. And someone with traumatic brain injury may go ahead and scratch anywhere at any time with anyone present. So some of those disinhibitions or impulsive, acts may be more common when you've had a traumatic brain injury. So brain injury can affect, even in that sense, our mental state or our emotions. And so that takes a different kind of therapy and reassurance. And some of those may not recover.
He told me the story when we went to rehab that normally a 10-minute trip with him and his wife took him 45 minutes because he gets lost. He forgets left and right. If you tell him the directions, turn right at the street and turn left at the next street, he doesn't know which his right and his left is.
When I would tell someone, hey, we're getting gas at pump number 8, and they'd be like, there's no car at pump number 8. There was times also, I remember this, depositing checks at the bank, and I would deposit checks or cash at the bank because I'd cash my paycheck, go deposit at my bank. I would give the bank teller some money and then get my receipt, walk out, and I would go, wait a second. And I deposited way more money than this. I'd go back into the bank and I would get into it with the bank teller, say I deposited $20 more and $30 more, and she would, no sir, and they would count their drawer, and sure enough their drawer was fine. And they would even go back and look at the camera, and they're like, look, there's the money all laid out, that's what you gave us.
So sometimes it gets tough when awareness returns. I'm a traumatic brain injury person, and all of a sudden they realize, my body's not working the way I recalled it to work in the past, or I can't do things that I knew I could do in the past. Then they have to deal with that. They have to adapt, to the change.
What's interesting about the brain is that the brain itself doesn't have sensors. I mean, he never says, look, I got surgery and my brain hurts. It's the oddest thing. Even though the brain controls and receives messages from the entire body about pain, and receives pain signals and sends back signals, the brain itself as a matter, as a gray and white matter, doesn't have pain sensors. That's the irony, that as strong as the brain is, someone else has to tell him that it's flawed, okay? He doesn't feel it, the world tells him. So I think that he has some difficulties mentally first accepting it. I mean, nobody wants to accept it, okay? And he doesn't want to accept the fact that he's not mentally thinking normal, like before his injury. And you knew you weren't making sense, or did you? You thought you were making sense?
I thought I was making sense. Okay. I really thought I was making sense. I thought it hurt probably my wife and my brothers more when I would talk different and I wasn't the same person I was. They would know it more than I would really know it, so it would bother me because they were looking at me like I was different.
Literally, their personality can change. They may act different. They may have new, peculiar ways of doing things. They may be perfectly well once again in reacting to everything, but they get mad real easy. So families do need a lot of support to try to put it into context and to figure out how best they can deal with this, both to assist the person who had the traumatic brain injury and to assist themselves.
For ourselves, we may say, well, I can find a way to get by it. I get a job that doesn't require me to do a lot of thinking, and I'm going to be fine. I can fake it, so to speak. I can get through it. But he's going to have a 3-year-old daughter, soon will become old enough to go to school. And when he starts helping with her homework and he comes up with different calculations because he doesn't understand that's a 5, not a 3, that's when the frustration is going to come out. Because he's going to deny it as long as he can. It's funny because the power of the brain is unbelievable. You can fool yourself, much like some patients with dementia or Alzheimer's, that you're not really forgetting things, that you're making good decisions, that everybody else is wrong, because the mind works like that. And we have to find ways to show you that what you're doing or decisions that you're making are flawed to some extent, in a ginger kind of helpful way. His wife sees it, and he recognizes it sometimes. So he's, in a way, telling me, you know what, give me some help, doctor. Give me some help. Let's talk about some of the things that you've had. I mean, you've got a lot of things going on. You have traumatic brain injury, which we'll accept that for motor vehicle accident. Traumatic brain injury is something we're going to have to get you some assistance with. We're going to send you to a specialist that can help you with that. So we have two subsets. We have the neuropsychological or the brain function, normal decision-making process to rehabilitate. And we have the physical area to rehabilitate. Because our goal as doctors and our goal as medical care providers is what? To bring them back to their pre-injury level. So the plan is to do neuroma scar injection, inject the scar itself. We'll do trigger point injections into the muscles that are both the shoulder blade and between the shoulder blades. See if that doesn't settle that scenario. We'll try to get a consult for neuropsychiatry for continued cognitive training. We'll do that for you, see if we can get that to improve to some extent. And let's see if this thing doesn't settle down.
All right.
I'll give you all the details and we'll get it done for you.
Okay.
Okay?
Thank you for your time.
Yes, sir. Pleasure meeting you. All right, good. She's going to get you ready, and I'll see you in the morning. But equally important, and during this whole time, our goal is to do therapy, to do rehab for him. Because without the rehab, both to the scars and also to the muscles, without that, he will improve somewhat, but it never will improve totally. How did you do with therapy? You love my staff. You told them thank you when they left. Your wife told them thank you. I mean, you said he's hurting you, but I was down there when they were giving you the therapy and you were fine. You were happy. I mean, I walked you out the front door. Well, that's not what I saw. Now, if you're having difficulty after therapy, you need to let me know, but that's not what I saw.
I would say that since the injections, I'm not experiencing as much pain as before the injections. I definitely feel better, sleeping better. So actually, like the first 3-4 days afterwards, I think for the first time got 8 hours of sleep. It's been a long time since I've slept 8 hours. Like about 3 days afterwards, felt pretty good because I was off of work for 3 days afterwards, so it felt good to just not have any pain. Probably without this therapy, I would probably have no choice but to not work, so I'm glad to have this therapy.
So the therapy is important to get him to be able to use the arm as much as possible, or even if he can't use it. Because of the injury to the muscles themselves, he has pain. So part of what he's trying to do is try to use the arm better, minimize the pain, and restore function.
Can if I help get a grip.
Okay.
Yeah,
Okay.
a little sore, but I got it.
Okay, let's see if we can do it, okay? Then we're gonna do
Oh,
here and here. Okay.
yeah, I feel that.
Okay, stop just for a second.
Felt good actually.
So therapy has two goals: increase range of motion or increase movement and decrease the pain. But first and foremost is improving the range of motion. But that's where I come in and do certain things like injections of the muscles that are injured or the joints, and try to minimize the inflammation around the muscles or the joints to allow them to go to therapy. So it's a twofold thing. We provide pain relief followed by therapy. Many times they come to me, they've had therapy, are not able to progress in therapy, so I have to have injections to what? To minimize the pain so they can go through therapy. It's a double-edged sword, it's a two-stage philosophy. Let me see here. So this is all better to touch?
It's definitely, it doesn't have that painful itch, that burning itch.
Sit up here.
It looks good, so it makes me.
Look, I think it's getting better.
Yeah, definitely.
I really do.
I noticed how the swelling went down, and it doesn't have that burning itch anymore. It almost makes you think, you know.
So for him, I am helping him both for himself to be a independent parent, both to be a parent, you know, with his wife, and be a father for his child. So when someone doesn't recognize the importance of getting neuropsychological treatment and therapy and training this early on, then they may not recognize it until it's too late. Then what? Then it makes them angry. You know, our goal is to keep people alive. I'm glad he is alive for himself, for his wife, for his daughter, for his family. But I think once you've had a traumatic brain injury, he is alive. Is he the same? That's a different question. You know, is he able to really think and look at information and discern information and make decisions like he did before? Not at this time. He's lucky to be alive for his daughter's sake, for his own sake, and for his wife's sake. And he wants to be alive. Is he the same person that's living today that was living before the accident? It doesn't appear to be so. All right, let's get on out of here and see how you do. See you, Lindsay, next Monday? Uh-huh. What it is? Do the best you can for yourself and for your wife and for your daughter. You owe it to them, you owe it to yourself to try to get better. All right, have a good weekend. Bye.